Hi, my name's Ian Battersby. I'm one of the medicine clinicians here at Davies Veterinary Specialists. As you know, we've been putting together a series of videos of behind the scenes footage to give you an insight into the areas of the practice. The area is mainly split into three zones: the diagnostic zone, the theatre zone, and this video is going to concentrate on the kennel area. Now, our kennel area is brand new, and we've just redeveloped it and expanded the kennel area, and it's L-shaped, and we're just going to walk you through the first part of the L now. Ooh. So this is the prep area, and there's a door to the right here that I'll just highlight. This is our isolation unit, so it's a self-contained area where there's facilities to nurse and look after patients with infectious diseases. Now at the moment there's a patient in there, so for understandable reasons we can't go in from an infection control point of view. Now as we move into the prep area, we've got quite a nice wide large space for the nurses to work in. And in this space there's our crash trolley, so that if any patients develop some unexpected complications, we can pull that out and have all the equipment there ready. There's a series of tables so that patients can have intravenous lines, intravenous catheters placed and blood samples taken. And this part of the kennels is split up into three zones. So we've got our surgery ward, our medicine ward, and then our walk-ins. Now in the surgery ward, we have patients, well, self-description, who've undergone surgery. So typically that'll be neurological patients or patients that have undergone orthopedic surgery. In our medicine ward, that's the area where I work, internal medicine, we have patients that have undergone a lot of diagnostics and are undergoing drug therapy and supportive care. Now, as we move around the corner, we move into our walk-in kennels. These are for larger dogs, just to give them that extra little bit of space. And at the end, we've got our food preparation room to get all the meals ready for all our inpatients. And one other area just to highlight to you is our walk-in showers. These are for our large breed dogs, so that they're designed at different heights, so we can make sure that our staff don't have to bend down too far, and it's also very comfortable for the dogs having a bath. As you can imagine, this is can get quite a wet area when you've got a big dog that wants to shake off all the excess moisture, so it's all wiped down, and there's a series of towels and wellies for all the staff to wear. So we're now in the second part of our kennels, which, as we said before, is L-shaped, and we've just completed a refurb of this area. But before the patients move in, we thought we'd give you a little tour, so it'll be a little bit easier. So this is a very similar set out to the other side of the kennel block. So we have a prep area where patients have blood samples taken. We've got facilities for washing patients, and we've got the food preparation area. We've got a walk-in kennel ward here for large dogs, and we've got a second ward with kennels for medium to small dogs. So what's slightly different to this part of the kennel block is that this is where our ICU is located. So all of our iller patients needing higher nursing needs will be located. And the ICU has just undergone a refurb as well. And we'll just take you in there now to have a little look. Again, prior to any patients actually being in here. What we've done in this space is that we merged a previous medicine ward with our old ICU to create a much larger space, which is enabled us to create one part of the room as a high dependency area. So this is for patients that need very close monitoring but are not as critical as the true constant monitoring ICU cases. Over here, this is where all the critical ICU cases will be, undergoing one-to-one monitoring by nurses. Now, you'll just need to use your imagination a little bit, because obviously we've not yet moved in all the equipment, but similar to some of the equipment you've seen on the other videos with the anaesthetic monitoring and things like that, that's very similar equipment to what we use in here, and that'll be stationed all on this wall with patients on mattresses underneath. Now, as you can imagine, we're very excited about this room. It's a nice big open space, it's very light. But we have made sure that we can control the light in this area, because in some situations, if you've got a patient that's seizuring, you need to keep a very low light level. But we're very excited because this is not only going to be a great space for us to do all this level of critical care and monitoring for our patients and really make a difference. It's also going to be a great space for our staff to work in.